Hello, my name is Liz Dreyer and I work as a surgical first assistant in neurology, predominantly for robotic operations. I assist the surgeons during surgery and there is a high chance that I may be involved in your operation. You may meet me prior to your anaesthetic on the day of your surgery. On arrival to the anaesthetic room, you will have monitoring equipment put on to measure your blood pressure, heart rate and oxygen saturation. This equipment will stay on for the duration of your procedure and recovery within the theatre suite. The anaesthetist will insert a cannula, which is a small plastic tube, into the back of your hand to allow a drip to be attached to give you fluids during your anaesthetic and surgery. Most people will have a spinal anaesthetic, which is an injection into your back for post-op pain relief. All patients will have a general anaesthetic, which requires a tube to be inserted into your trachea, which is your windpipe, to allow the anaesthetic machine to control your breathing. Once you are asleep, we position you very carefully to ensure any pressure areas are protected during surgery. For patients having robotic surgery, you will need to be positioned head down on the operating table, known as Trendelenburg position. This position creates room inside your abdomen to allow the carbon dioxide gas used in laparoscopic surgery, which is keyhole, to inflate your abdomen. For safety, we use lots of positioning aids to ensure you remain safe on the operating table during your procedure. This position can cause facial swelling as a result of being head down for a number of hours. However, this usually resolves by the time you have woken up in the recovery area. You may also find some shoulder discomfort from the position and also from the carbon dioxide gas, which can cause shoulder pain post-operatively for some patients. For those of you having an open prostatectomy, you will remain in the supine position, lying flat. All patients will have a special warming blanket that will help to keep you warm during surgery. Once in theatre, a member of the surgical team will prepare you for surgery. For robotic surgery, you will have 6 small cuts in your abdomen. One of these wounds will be extended slightly at the end of surgery to get the prostate out. You will have local anaesthetic put into the wounds at the end of surgery for pain relief, and surgical staples are used to close the wounds before the small dressings are applied. Some patients may find swelling to their genitals after surgery. This is normal and nothing to be concerned about. However, if this causes you a lot of pain and discomfort, let one of the nurses know, who will discuss pain relief with you. You may also have some abdominal bloating, which should resolve without treatment. For open surgery, you'll have just one slightly larger wound below the belly button. This wound will also be closed with surgical staples. Open surgery is associated with an increase in pain and bleeding compared to robotic surgery. A special machine is used for blood loss called a cell saver, which collects blood loss during surgery to be given back to the patient. This will be discussed with you on the day of surgery, and for those patients who consent for the cell saver, it is a very good method of coping with any blood loss. The anaesthetist will take steps to control any pain, such as having a spinal anaesthetic, and will prescribe further pain relief for your recovery should you need it. Robotic surgery is minimally invasive, which results in less pain and reduces surgical bleeding. The technology of the robot is designed in such a way to minimise any trauma associated with surgery. However, some pain and discomfort will still be felt, but this should be manageable. Pain relief will also be prescribed for robotic patients should you need it during your recovery. Prostate surgery usually takes around 3 to 5 hours, with a period of time spent in the recovery area after your surgery. It is a good idea to let your relatives know that you will be away from the ward for most of the day.